evening, folks. Welcome to superpoints.ai. Today, I would like to talk a few minutes about tribal health in India. Very, very important because government of India, in its pursuit of public health expansion, is focusing on underprivileged groups, especially scheduled tribes. Okay, so scheduled tribes, they are communities recognized under Article 366(25). Okay, that's an interesting point there, and it may come as a question. They are recognized under Article 366(25). We have like 104 million tribal people belonging to about 705 tribes, and they comprise 8.6% of the population. Most of them live in remote, hilly, forested, difficult to reach areas. Due to geographical isolation, poverty, illiteracy, poor infrastructure, and inadequate health services, tribal populations continue to experience poor health indicators compared with the general population. So, underprivileged who need more get less. So, that is the problem. Underprivileged, they need most, but they get very less. And we have to bring equity. That means, like, the downtrodden should be given adequate portion in the modern healthcare. So 90% of tribal people live in rural areas. Tribal population is concentrated in central India and northeastern states. Madhya Pradesh has the largest tribal population. Sex ratio among STs 990 females per thousand males, and child sex ratio 957 girls per thousand boys. Literacy rate 59%, male literacy 68.5, female literacy 49.4, life expectancy at birth 63.9 years. So now, health status of tribal population, you have to go through major programs. We have a RMNCH plus A program. They have identified early marriage, childbearing, maternal undernutrition, high prevalence of anemia, low institutional deliveries, poor postnatal care. Like almost 50% of women have iron deficiency and anemia in general population. And in scheduled tribes, it is actually more. And institutional delivery is 68%, skilled birth at Indian 71.5%, and infant mortality rate 41.7 per thousand live births. Also, this document you can download, and we are going to do some MCQs also. So follow me on that document, and you can do these MCQs again and again because you will get some MCQs from this section in your exam. So under 5 mortality rate 50.3 per thousand live births. Immunization, fully immunized infants 76.8%. Malnutrition remains a major health problem. So we have stunting, wasting, underweight, and the burden of diseases in tribal communities are communicable diseases. Tuberculosis is a huge problem. All right. So tuberculosis, you will get a question on that. What is the most prevalent communicable disease among scheduled tribes? The answer is tuberculosis. And then we have malaria. Malaria is also common because these people live in forests. So there is a huge mosquito population. They suffer from Plasmodium falciparum malaria. And we have leprosy, HIV, hepatitis, diarrhea. So prevalence of tuberculosis is 703 per 100,000 population. So they use mobile TB diagnostic vans because they live in remote areas You have to use these mobile TB diagnostic vans with equipped X-rays and sputum microscopy, uh, dots, medications. Everything is going into that remote area using these mobile vans. Then leprosy is a problem. Malaria, 30% of malaria cases happen in a tribal population. Think about that. They are 8.3% of India's population, but they have 30% of malaria cases in India. Then there is 60% of Plasmodium falciparum cases, and they also have 50% of malaria related deaths. So, if you want to uh, effectively bring malaria related deaths, you must go to serve these tribal people. Then there is non-communicable diseases, hypertension. 1 in 4 tribal adults have hypertension. They have blindness and visual impairment. They have genetic disorders like sickle cell disease. So sickle cell disease is a problem here. 1 to 40% have that problem. Then there is G6PD deficiency is a problem. They have mental health and addictions, tobacco use 72%, alcohol 50%. So the consequences include non-communicable diseases, reduced productivity, poverty, family and social problems. So different consequences happen, just like in the general population. And because they live in forested areas, they have high incidence of snake bites, dog bites, scorpion stings, human wildlife conflicts. Now, healthcare infrastructure in tribal areas. What are the norms under National Health Mission? All right, these numbers are important. They have a sub center for every 3,000. We have a sub center. Then for every 20,000 we have a PHSA, and there are for every 80,000 we have a CHSA. So existing problem: shortage of health facilities, poor transport, difficult terrain, inadequate referral services. Human resources: we have shortage of doctors because it's hard to go to those areas and serve them. And there is poor retention of health personnel, professional isolation. Because if you are a doctor in a tribal area, which itself is a remote area, your friends are not nearby. Okay, so there is that isolation and pressure because of the professional isolation. There is difficult living conditions because people need to adjust the lack of electricity and lack of water. Safe water, inadequate infrastructure. Often you don't even find a good road or transportation to these areas. So, what do you do? Recruit local tribal youth. Now, let's start medical colleges in tribal areas and train them. Then, strengthen ASHA services. Strengthen ASHA services, deploy mid level health practice providers like Anganwadi workers, DAIs. Then provide incentives and higher salaries. Higher salaries may help to reach these remote areas. Establish dedicated medical colleges in tribal districts. So, government initiatives include Tribal Sub-Plan (TSP) introduced for accelerated tribal development, and there is National Health Mission. It focuses on maternal and child health, immunization, disease control, infrastructure strengthening. So we have all the other disease control programs like National Tuberculosis Elimination Program, National Leprosy Eradication Program, National Vector-Borne Disease Control Program, National Program for Control of Blindness and Visual Impairment. They are all active in tribal areas. Then we have challenges: geographical isolation, poverty, illiteracy, malnutrition, poor sanitation, cultural barriers, inadequate health infrastructure, shortage of trained manpower, high burden of communicable diseases, and rising burden of non-communicable diseases. So, to conclude, tribal population in India continue to suffer from poor health indicators, unequal access to healthcare. They face a triple burden. What is this triple burden? They have communicable diseases, non communicable diseases, and nutritional deficiencies. Strengthening healthcare infrastructure, improving human resources, promoting community participation, and implementing targeted tribal health programs are essential to bridge the health gap and achieve equitable healthcare for tribal communities. So, with that introduction, I would like to ask you to join me to do some MCQs. Okay, you can download the document I gave below this video, and you can follow me, and you can do this again and again by downloading the document. So, scheduled tribes are defined under article. The correct answer is B, 366.25. Tribal population constitutes approximately. So, tribal population is 8.6% of India's population. Approximately how many tribes are recognized in India? We have like 705 tribes. Which state has the largest tribal population? The largest would be Madhya Pradesh. All right. I told you central India and northeast India have the highest concentration. Life expectancy among scheduled tribes is approximately 63.9. Infant mortality rate among scheduled tribes 41.7. Which nutritional problem highly prevalent would be stunting? The prevalence of pulmonary tuberculosis among tribal populations. So the prevalence of pulmonary tuberculosis is 703 per 100,000. Which innovative diagnostic service is used to improve tuberculosis detection and treatment in remote tribal areas? As I told you, that would be C, mobile TB diagnostic vans. Scheduled tribes constitute approximately what proportion of malaria cases? Approximately 30% of malaria cases. More than what percentage of Plasmodium falciparum malaria cases occur among tribal populations? So 60% of malaria. I think I already covered that earlier when we talked about malaria. So yeah, 60% of Plasmodium malaria cases and 50% of malaria related deaths are among these tribal people. And then hypertension affects. It affects 1 in 4 tribal adults. 1 in 4 tribal adults. So it's very 25% of adults have hypertension. You need to deal with that. You need to, like, again, the tribal people are coming to you. Expect 1 in 4 of them has hypertension, and you need to treat them. Sickle cell disorder prevalence among tribal communities is very high, 1 to 40%. Which enzyme deficiency is commonly observed among tribal populations in India? B, G6PD deficiency. Approximately what percentage of tribal men use tobacco? 72%. One's health sub-center in tribal areas. Sub-center, it is 3,000 people. So B. PHC, population norm for a PHC in tribal areas, it is 20,000. So you need to have a PHC for every 20,000 people in tribal areas or hilly areas. Then population norm for a CHC in tribal areas. That is important. You see tribal areas. So the answer is 80,000. So in tribal areas, hilly areas, if you have a CHC, you should have for 80,000. Which recommendation was made by the expert committee on tribal health? C, training and deployment of local tribal youth in health services. Let us see some recent PYQs. Major health challenge currently faced by tribal population. That is a triple burden of disease. All right, triple burden. Number one is communicable diseases. Number two, non communicable diseases. And number three is nutritional deficiencies. All right. So they have nutritional deficiency, communicable disease, non-communicable. So that's why they have triple burden of disease. Which disease accounts for a disproportionately high burden in tribal populations? Tuberculosis. They have a high proportion of tuberculosis. Most important genetic disorder among tribal population is, as I said, sickle cell disease is the most important genetic disorder. And whenever a tribal person comes and complains of having joint pains and vision problems as they live in the tribal areas, you should always think about, does this person have sickle cell anemia? Are they going to have these vaso-occlusive crisis? What is happening? Like that. You need to think about sickle cell anemia whenever you see these tribal people. Under NHM, the population norm for one PHC. So in tribal areas, PHC 20,000. Which of the following is recommended for improving tribal health manpower? And as I said, it is a C. Train local health and deploy them in health services. Okay, folks, that is about tribal health in India. So make sure you remember those important things like what is the population for subcenter, population for PHC, population for CHC, and what kind of problems they have, the incidents. Like so it's all about public health. Preventive and social medicine is about knowing those most important things. When you think about tribal people, what is their population? How many of them are living in India? Where are they located? What are their main problems? What are their current condition? What is their literacy rate? What is their child sex ratio? And what medical problems they have? What communicable problems they have? What non-communicable problems they have? What nutritional deficiencies they have? And how are you going to address them? So you need to think in those lines. If you think along those lines, and this is a very, very important concept, both for education and also as you contemplate your career. Maybe you might want to work in a rural area, and people get shudders when I say rural area, right? Uh, I want to live in a big city like Hyderabad, Chennai, Hyderabad, and no, you can also live in a remote area serving these people. For example, I am living in a remote area and serving people in a remote area. So you can do that too. Some of us should go to remote areas, taking care of people in villages. All right, folks, that's for today's episode. Visit us at www.superpoints.ai, and you can do thousands of questions as you prepare for your NEET exam, and take our courses, and you will definitely see the success you have been dreaming about. Thank you. I will see you in the next episode.